Good afternoon. Welcome to the special Superintendent's Webcast for June 23rd, 2020. We will, of course, want to welcome all of our superintendents, their designees. Again, we also have representatives from the Kentucky Non-Public School Commission as well as from the various Kentucky Diocese schools. Thank you for joining us. And also, of course, representatives from the various K group organizations that represent superintendents, local boards of education, and I believe Commissioner Tackett usually always joins us, and happy to have him with us today. We have, if you look at the agenda, we have actually a shorter list of agenda items, but I believe it will take us through 4 o'clock because obviously very important items on reopening school. Again, we have Drs. White and Drs. Meserly with us today to talk about that. We're going to do that at the end of the presentation since that's probably going to take the bulk of the time. I'm also going to address at the beginning of that presentation some issues raised from superintendents from the OVEC region. Very good questions that I know you're also having in your district. We'll talk about those things. These are some things we talked about, or if not all of them, we talked about with the Superintendent's Advisory Council yesterday. So for those of you who are members of the Advisory Council, this will be a repeat of some things we discussed, but we got great guidance and feedback from you yesterday, and I know we will continue to do that today on the Superintendent Webcast. And then, of course, as if you don't already know, the governor has announced that he will announce the public health guidance for reopening schools at tomorrow's press conference. And we are still, that was the purpose of the delay until Wednesday, was for so we could have the Superintendent Advisory Council today and the Superintendent Webcast today to continue to hear feedback from district leaders on this reopening guidance and the issues that we've been talking about for several weeks now. And we all know what those are: the social distancing issue, face coverings, and other issues such as temperature checks. And then, of course, we've been talking about funding and how that looks. And so I think we have some good news for you. I do want to stress, though, that, and I want to encourage everyone, I'm sensing there's a lot of anxiety out there. I know there's anxiety out there, and that's natural. That's normal. We're in a global pandemic. We're in a time in our country we really haven't faced before, at least not since the early 1900s, related to a public health emergency of this magnitude. However, I am always comforted by the fact that we're in Kentucky and that we have one of the best teaching corps in the country and one of the best groups of school administrators in the country. I know this not because I'm biased, because I'm a Kentuckian, because I have been around it my whole life being educated, as many of you have, as well as spent my large part of my career interacting with public school officials and teachers. And so I know that we can rise to any occasion. We already have an example of that last semester when within 48 hours we went from 80 school districts delivering non-traditional instruction to 172 districts. And we went from not every school district delivering food and serving food to students to over 2,000 food sites by public school districts. And I would put that up against any state in the country and any country in the world. And so I am comforted by that. That doesn't mean we don't disagree. That doesn't mean we don't have anxiety. That doesn't mean that we get or have these discussions on social media and try to figure out, that's part of our society, try to figure out the best way forward and talk about different ideas. And then we always end up in a place and we try to work together to do what's best for kids in our community. So that's exactly where we're headed with this. I do believe after the document is released tomorrow that you all will be pleased with the formatting, with the direction that it will take us as far as having a definite guidance and what is a public health requirement and what are best practices. I know you've been asking for that. And one of the reasons of the delay is that we wanted to have continued conversations with public health. And Dr. White and Meserly, I'll thank you again, but we also want to thank you particularly over the last 3 to 4 weeks. We've had many conversations, sometimes many conversations during just the course of one day. And then also the support of the governor's office and the lieutenant governor and all of us trying to work together to reach the best solution. Again, that doesn't mean it's going to be easy, but I believe we've arrived at a good place considering the many factors that we have to overcome. So with that, we will begin. We first have a communications update with Tony Cons-Tapman from KDE. Tony?
Yes. Hopefully, oops, sorry, I got myself off there. Are you all seeing my screen okay?
Yes.
Okay. All right. Hopefully we solved that problem. All right, so there's the agenda. All right. So I first wanted to go over, in light of tomorrow's announcement with the DPH's Healthy at School document, just wanted to remind everyone of the KDE guidance that has been issued for the reopening of schools. Since May 15th, we have been releasing weekly guidance documents to all of our superintendents and districts in regards to reopening schools for the 20 and 21 year. We've also created the KDE opening guidance tab on our COVID-19 website. This is this tab that you see here in green, where you can find all of the guidance and our weekly superintendent webcasts, which we have been holding since March. And then on the next slide that you can see, I have linked for you each of the guidance documents, including the guidance document that you will hear about coming up next on the food service operations. And as you can see, the guidance to come includes transportation, workforce health and safety, facilities and logistics, et cetera. So you can use that as you prepare for local reopening of your districts to come.
Tony, if I could say something real quick while we're talking about the guidance. First of all, I want to thank the KDE staff, but also more importantly, the work of the Education Continuation Task Force, as well as all the advisories we've conducted since March that have informed this guidance. Now, having said that, I'm proud of the guidance. I'm proud of the staff in getting our website to a point where it's more easily accessible, even though it's not where we want it to be. I also want to recognize that just because we've issued these guidance documents, and we will issue, including the public health guidance document on or before July 15th, around 15 documents, I know that does not mean that it's easy. I also know that no human can probably sit down and read every guidance document, and that you have to rely on your staff. I encourage you to make sure these guidance documents are distributed to your staff. And those of you in smaller districts, you may have to sit down and read through them or become familiar with them. At the same time, because we have also taken some best practices we're seeing in other states, and they're doing the same from us, and we've gotten feedback from the field, the guidance documents aren't perfect. We've not thought of everything, and they will continue to evolve as we get feedback from you, just as the Healthy at Work document that you may have heard the governor talk about that had guided the reopening of our economy in Kentucky. Those documents have continued to evolve as the virus changes, as the situation on the ground changes. So I want to tell you how important guidance documents are, and we're glad we have those. I also don't want to diminish the challenge you are facing, and there's really no guidance document that can prepare you. Only not even your leadership classes and everything you did to become certified as a superintendent can prepare you for this. But we know that you're going to make it happen, and we know you're already working to make it happen. So I wanted to put some perspective on these documents and obviously give you an encouragement. If you haven't done so, make sure you're sharing these to other folks in your school administration and your buildings.
Okay, thank you, Commissioner. The next thing I wanted to talk about in relation to the reopening of schools is the survey that Karen Dodd's office has been issuing. So we're calling it the COVID-19 needs sensing surveys. And so the superintendent survey is now closed. We received a total of 146 respondents. Teacher survey, we received just over 5,100 responses. The family caregiver survey is still open until tomorrow. And right now as of 10 a.m., we were sitting at 57,370 responses. And then also in Spanish, we have received just over 200 responses. And then in the principal survey, you will see that we have also received just over 500 responses. And again, all of those that are still open are linked there for you. So if you want to share those with your staff, your principals that are still may not have taken the survey, please do so, because we are using these to guide additional feedback that and guidance documents that we will be issuing to all of our local districts as we continue supporting and feeding and guiding our districts. In addition, all of our survey results will be shared, I believe, I can't remember, I think it's mid-July. Is that right? I can't remember what Karen had said. I'm not sure if she's with us right now.
Yes, it is mid-July. We should
That's
have
what
it
I
out
thought.
there.
That's what I thought. So we're very pleased with the results so far. But if you are a family or a caregiver that has not taken the survey yet, we encourage you to please do so. Also, our principals. The next slide is I want to also encourage you to nominate to please nominate somebody for our Kelly Business Partnership Award. To date, we have only received 6 nominations, and I know that there are a lot of businesses that do a lot of great work with our schools and districts that lead to improved student outcomes. And so I really encourage you to submit a nomination for the Kelly Award, which will be given to an individual this fall. And again, you can click on that link to go ahead and submit a nomination for that award. And then the last update that I have for you today, I believe, is on the commissioner search. And where we are with that is this week on the 25th, the search firm will be meeting with the Board of Education to go over the background searches on 6 individuals that they have proceeded to this point. At that point, the board will likely be narrowing down the search. I'm not sure which number. I guess it depends on what comes up with what the results are of the 25th meeting on the 25th. And then the next scheduled meeting is going to be on July 6th and July 7th in Louisville. One of them is going to be a dinner, and then the next day will be a second round of interviews. And I don't know if the commissioner wants to add additional feedback, but right now we are looking for a potential announcement of a commissioner towards possibly the end of July, mid to end July, early August. And I have been asked questions in terms of will the names of the finalists, or I'm not sure what the board will call them, if they're going to be called semifinalists or finalists or candidates. But right now it is the plan is to name who the finalists will be before a commissioner is named. That is the intention of the Board of Education. Commissioner, did you have any additional comments on that?
I think that's correct. That's also in keeping with the majority of the commissioner searches of the past since 1990, with very few exception, that the finalists, at least the final 2 to 3 are named. And I would just add, the note here says a commissioner is likely to be selected by mid-July to August. That's certainly doable. And just so I know, it's important to you to know when the person would be actually on the ground as the commissioner in the office, because it's important that I know we, even as an interim, I received before the pandemic a lot of invitations to come to visit districts, and that's important. It's also important to the co-ops, et cetera. And so, we're probably guessing that the commissioner would be on the ground as early as August 1st, or maybe as late as September 1st. We know that the person will have to give notice to their current employer. They're in the past, I know we've had the selected commissioner maybe had a vacation planned or something that they would want to honor. So, but I think we will have somebody here in place sometime in the month of August, it looks like. So I think it's very exciting, and as much as I love you all, I know I'm looking forward to it.
Me too. Anyway, so that's all I have today for you all, and I will, the next slide is going to go right into our guidance document that we released this week.
Yes, we have with us today Katie Embry and Jennifer Langfels with our KDE Division of School Community Nutrition to go over the food service operation guidance document.
Thank you so much. Hello, and thank you for allowing us the time to speak with you today. We want to first begin by saying thank you. Next slide, please. We want to first begin by saying thank you to each and every one of you. Thank you for your support and your efforts in continuing to provide meal services to students during this time. We know it's not been easy. However, you have risen to the occasion. I also want to share with you a few examples of your efforts and the positive impact on our students. First, the PEBT program at this point has provided over $155 million in benefits to over 500,000 students, which means families have a few more grocery dollars to help feed their children. The application is still open on the Benefund website until July the 10th for eligible students. We also have 20 districts participating in the Baylor University Emergency Meals to You program. Families in those districts are receiving 10 days worth of meals every 2 weeks, and that program continues until June 30th. We still have sponsors providing meals through the Summer Food Service Program and Seamless Summer option. And finally, 88% of our National School Lunch Program sponsors have at least some level of participation in the Community Eligibility Program, with 76% of those sponsors having full participation. That means in the majority of our schools, families do not have to worry about the cost of breakfast and lunch for their children in the upcoming school year. Thanks to your support and your hard work, that's everything that you're doing. If you currently do not participate in CEP and have eligible schools, you have until August 31st to elect to participate for next school year. Just let us know. Next slide. Throughout the spring and into the summer, the USDA has provided many waivers of program regulations that allow the current models of providing meal service possible. These waivers allow schools to serve and claim meals on NTI days, provide meals for multiple days at a time, allow households to pick up meals and take them home, and also allow schools to deliver meals directly to homes. However, now these waivers are set to expire in late summer and early fall. Without extensions of these waivers, these meal service flexibilities will not be able to be utilized for school meal programs. SCN is very much aware that many districts are preparing reopening schedules that involve students utilizing NTI during the week to reduce school building capacity and would like to be able to provide meals to students on days when they are receiving instruction at home. We are currently working with USDA to ensure that they understand the importance and the urgency of allowing schools to continue to operate with waivers in the upcoming school year, and we are hopeful that additional guidance will be released in the near future. We are in the process of writing state-level waivers for the National School Lunch Program to be proactive since nationwide guidance is delayed. With that being said, for today's presentation, we will only focus on meal service operations that take place in the school building for enrolled children. It's important to also note that this guidance focuses on school meal sponsors that operate the National School Lunch Program, but many of the basic tenets of these recommendations can be applied to all meal service operations. Each district will need to come up with their own individual plan, given the number of students and the layout of the buildings. The four main areas of consideration that we will discuss today include meal service environment, meal pattern, food safety plans, and operational support. Next slide. To begin developing a food safety operation plan for your schools, start by identifying locations within each building where it may be feasible for meal services to be provided and/or consumed. This may include delivering and serving meals in classrooms, gyms, or other large open areas. It may include serving grab-and-go meals that can be taken to other locations, such as gyms or classrooms. This also may include setting up the cafeteria for traditional use with adjustments made to allow for reduced capacity. Multiple methods may need to be utilized simultaneously in order to be able to provide students access to school meals at breakfast and lunch times. Any service model utilized must be able to allow for the physical distancing guidelines to be observed and also enable contact tracing to occur in the event an individual receives a diagnosis. Next slide. Meals should be served in a supervised, non-congregate setting. It's important to think through all the aspects of meal service in order to identify any additional equipment, supplies, or staff that may be needed for meal service methods that will be used. Another important factor that must be taken into consideration is the amount of time planned for meal services. Extended meal periods may be needed to allow for adequate time for students to wash their hands, for staff to provide multiple meal service models simultaneously, for staggering meal service periods so that the arrival and dismissal times limit the amount of contact between students in high traffic areas, and for staff to implement enhanced sanitation standards, such as cleaning all high-touch areas between each student use. Another consideration for the meal service environment is ensuring that all self-service of food is eliminated and the use of share tables and sharing of food is prohibited to reduce the amount of shared contact. Next slide. Food service staff must also be mindful to follow proper procedures to ensure student safety as well as their own in mitigating the risks of exposure to COVID-19. Although district protocols already exist for illness, staff must take additional precautions at this time. Staff should follow district protocols for temperature taking upon arrival to work. Staff must wear appropriate personal protective equipment such as a mask and follow district protocols if they experience symptoms so that contact tracing can be done if necessary. It is important to create a culture of safety so that all staff are working together in reducing the risk of exposure and transmission of the virus. You should also anticipate staffing shortages that may occur due to illness and develop potential staffing contingency plans. Provide food service training to any staff who may be asked to assist. Next slide. Thank you. Also, meals served in schools that participate in the federal child nutrition programs must meet the required meal pattern guidelines in order to be eligible for reimbursement. Menus should be planned, taking into consideration the specific needs to the meal service methods that will be utilized. For example, if meals will be transported and served in locations outside of the cafeteria, the menu planner will need to take into consideration whether schools have hot, cold holding equipment that is needed to allow for the service of hot meals, or if they need to plan meals that do not require food to be held hot. Consideration should also be given to the time it will take for staff to prep for meal production and the time it may take to pre-portion or package menu items. It may be necessary to plan menus that require less staff preparation time. It is very important to have a clear communication plan in place with staff and students and households when providing meal accommodations to students with disabilities. Accommodations for disabilities that enable equal access to the program must be provided when supported by proper documentation. Meals must also be served in a manner that offers a safe environment for children with food allergies. Staff must communicate and work closely together to ensure safe meals are provided when needed. Next slide. Another area of consideration is food safety. All schools and/or feeding sites are required to have individualized, written food safety plans in place to ensure safe food practices. The written food safety plan must include standard operating procedures that are specific to the processes that are used within the site to mitigate food safety risks. It is important to review the current food safety plan at each school or feeding site to ensure that they include standard operating procedures for any new meal service method or newly added procedures in place due to COVID-19. And most importantly, all food service staff, as well as any other school personnel who may be involved with food service operations, must receive training on the standard operating procedures. There should also be a greater emphasis placed on SOPs for hand washing, proper glove use, personal hygiene, serving safe food to students with allergies. Excuse me. cleaning and sanitizing contact surfaces, and the food service health policy. Training and communication is paramount to ensure that food service maintains a culture of food safety. Next slide. The final key area to consider is operational support. It will be very important to have clearly written operational policies and procedures that are communicated to all stakeholders. Coordination and communication between food service staff, building administration, and other building staff, as well as students and households. It is important to keep everyone informed. It will be important to share how communications will be received. Internally for staff within the school building, and also externally with households. Next slide, please. Finally, SCN has a variety of resources available to support you in planning your implementation efforts. There are links to resources available at the end of the KDE Meal Service Reopening Guidance document. In addition to those, we are hosting a webinar for food service directors of the National School Lunch Program on June 25th. School food service directors have been notified of this opportunity. Also, we have dedicated staff that can assist districts that would like additional help. If you would like to take advantage and request additional assistance, please send an email to Kentucky School Nutrition, the mailbox, with the subject line COVID-19 Meal Service Operations Assistance Request, and we will be in touch with you. Thank you, and let us know if you have any questions.
Thank you, Katie and Jennifer. Tony, do we have any questions on the soapbox? As a reminder to participants, you can use the Go Soapbox link to submit your questions to us, and then we will address
checking
those.
for those right now. Just give me a second. I got to go through. There's quite a few for the other topic, so.
So can you reiterate this is a question I'm pulling from one of the co-op raised issues that superintendents are needing food service and meal reimbursements information on the summer feeding payment structure. Can you go over that again?
Yes, Jennifer, do you want to take that one?
Sure. So as of right now, there are waivers in place that allow for that food service operation to happen. I believe the waiver for that with NTI days ends on August 31st. So we are working with USDA to get an extension of that waiver or another waiver of similar meal operation that would be allowed to be served. So we are currently working with them to get something in place.
Okay, thank you.
I am not seeing any questions. I'm going to go check the Google Doc real quick. So just to make sure we're not missing anything on there.
Jennifer, are you able to comment whether we, from your national contacts, whether we are hearing that that's a favorable, we are likely to get a favorable waiver from USDA? My guess is it would be yes, just considering the nature of the crisis we are in.
We have heard is that there's something that's going to have to be done, but at this point in time, they're not able to say what that might be exactly. So we're expecting something soon, and maybe, hopefully, very soon, the next few weeks.
Right.
And
and I know
Kevin,
we
this
also,
is, I'm sorry, Commissioner, this is
Go ahead.
Lauren Moore. I was just going to comment as well. So we had a call last week with our regional office, and the indication that we got was that the national office is working on nationwide waivers and that those would come out, but it, as Jennifer said, it would be within a few weeks. And so we decided and let them know that we were going to go ahead and send state waivers so that we could have something in place sooner than that.
okay, thank you.
It looks like all of our questions are going to be for our next item on the agenda.
Okay, well, we will move forward then. Again, thank you, Katie and Jennifer. And again, I want to echo the thanks that Katie and Jennifer and Lauren extended at the beginning of their presentation up to you for the effort. It's truly historic what happened last semester and what you are continuing to do over the summer. and we know that you're going to continue to do innovative things to ensure that your students are fed as we enter a very unusual and unprecedented beginning of this school year. Next, we have our discussion with our friends at the Department of Public Health. We don't have any slides because this is going to be a discussion. We have had several presentations to not only this group from Drs. Meserly, Dr. White, and Dr. Stack over the past few weeks, but also to all the advisory councils. It will come as no surprise that, that you can kind of separate it in various buckets of the issues related to masks, temperature, social distancing, and various issues. And we're going to begin by going over some of the questions, though, that came up through an education co-op, actually, I think through more than one, to kick us off. And then those questions will lead us into some specifics discussions with Dr. White and Dr. Meserly. And then, of course, the document that everyone's been waiting for that will, have in writing these both public health expectations as well as best practices will be issued tomorrow, announced at the governor's press conference. First, I want to start off, and public health folks, some of these may or may not involve you. We'll handle it just like we did at the superintendent advisory yesterday. The first question we've received from you over the last week from superintendents forwarded us by co-ops. There's still a lot of uncertainty out there, you're saying, and you need specifics on funding issues before that you can begin to think about anything else, and not knowing how you're going to be funded. For example, if you if you've done a survey, for example, and you have 10% of your parents saying they're going to keep their kids out, you want to educate those kids at home, while the other 90% are in classrooms. We understand that. We have a plan for that. And I think you're going to be pleasantly surprised. We've talked a little bit about it in other previous webcasts, but that's being finalized as we speak. Robin, can you walk us through what we're expecting?
Sure, I'll be glad to. Thank you to all the superintendents and other interested parties that we talked with this issue about last week. We talked with the Superintendent's Advisory Council. We've talked with on Superintendent Webcast. Then the Division of District Support Services also had webinars with both finance officers and DPPs. So this is an area that we know everyone is interested in, and based upon your feedback and the comments we received, our recommendation for funding for both attendance taking in school year 20, which is the upcoming school year, and how that impacts funding for the next school year, which would be school year 21. Our recommendation is to remain in place the Senate Bill 177 language, which allows you to use that choice of data, either 1819 or 1920, that school districts submitted and picked based upon what was in the best interest of their district, and effectively we'll just slide that forward for a year. So what that means is we will focus less on attendance as it is tied to funding, because this will hopefully give you a little level of more certainty, although not guaranteed, because we know we are also in a situation across the Commonwealth and across the nation, really, about uncertainty about what revenues would look like. But this will help you plan. And because we are taking that step, of course, the question that we continue to hear is about how will we make sure, once attendance and funding is kind of decoupled from the student, how will we ensure that that instruction, that support, that participation is happening? And we know local school districts and the teachers in the classroom specifically, they want what is in the best interest of their students. They want to deliver instruction. It's why they're teachers in the first place, is to engage those students and make them successful. So we know that as an education community, but we also know that there will be needs for accountability in that regard. So we will be enhancing sort of those participation looks, participation, whether you have a student in person and being able to report that out, participating in your classroom,
participating remotely, either through engagement through technology devices or participation through the use of, for those students that unfortunately we still need to provide through paper and pencil instruction for instruction to happen, a participation level that way. So we will be working to kind of define what those participation levels look like. I have continued to ask ways that districts can help us define that, to make sure that we are listening to things that are reasonable and practical, but still verifiable. So we are still interested in your thoughts about what that would look like. And then we would ask that be reported to the Department of Education and also shared with the Legislative Research Commission so that the General Assembly can see what participation looks like in your schools and districts. So we hope that this will be helpful as you're planning. That will help you kind of have a starting point and then allow you to make those best decisions for instruction based upon a more known in funding. And you can pick the best options of instruction for your students. As I have said, we are not, our goal is to not either incentivize or disincentivize you from picking an instructional model because you have fears about your funding. So we hope this will be helpful as you make those decisions along the way.
Thank you, Robin. And for those of you that may be asking, well, how will the department accomplish that? You know that the General Assembly is not in session, and they will not be in session until January, unless there's a special session called. And so we are operating under the assumption they won't be in session until January. And so we're going to be able to make this work for the next school year and the next semester by utilizing the governor's executive emergency authority. And this is similar to how we were able to waive the civics test, for example, early on during the pandemic. That a memo went over from the commissioner over to the lieutenant governor. The lieutenant governor, who's also the cabinet secretary, is authorized under the governor's initial COVID-19 emergency order to waive certain statutes and regulations related to the emergency. She waived that civics test requirement, and that's how we got there. Similar to that, a lot of what Robin described will be waived through that same mechanism tomorrow. And then how we define what the participation rate and how that's going to work over the next semester and next year will be worked out through an emergency regulation of the State Board of Education that will probably have to occur in a special meeting before we get to August. And so that's how that will occur. I really want to thank Robin and her team for putting in a lot of hours of problem solving and thinking up different methods and then going to the field to see what would work best. Todd, do you have any further clarification on the process of making this happen?
No, I think you accurately outlined it.
The only other thing I would add is this same process through the order and the emergency reg will also take care of the NTI day issue. It will repeat the language or similar to language in Senate Bill 177 that will give the commissioner the authority to grant as many NTI days as needed upon request of the school district next semester. So that will happen during that same process we just described. All right, the next issue that you've alerted us to still needing guidance on relates to the proportionality of employment contracts. And I believe Wayne Young at KASA has advised on this previous, and the issue is related to compensation when a teacher has for example, a 185-day contract but only works 170. So I'll have Todd, if you will, as you did yesterday with the Superintendent Advisory Council, go over this issue.
Sure. Thank you, Commissioner. As Commissioner Brown indicated, we've received several questions from school district superintendents throughout the state about the proportionality rules that are set forth in statute when a school district elects to use a variable student instructional year. Sometimes we've referred to that as the boat dock bill, and that allows school districts to start a little bit later in the year and receive credit for their school calendar for 170 instructional days once they reach 1,062 instructional hours, regardless of the number of days, student instructional days that they actually complete. So, for example, if a school district completed 1,062 instructional hours in 165 days, then that 165 days would be treated as the proportional equivalent for satisfying your school calendar of 170 days. The statute also has language that indicates that that proportional equivalency should also be granted for employment contracts. So for your employees whose contracts are based on the school term, it's our understanding that school districts would also grant them credit for 170 days worked once the district reaches 1,062 instructional hours, regardless of the actual number of days that it took to get there. A superintendent yesterday on the Superintendent's Advisory Council asked a really great question about retirement credit. The department has followed up with both teachers' retirement system as well as Kentucky retirement system. From the teachers' retirement system perspective, we understand that once the district indicates the teacher has completed their contract for the year, the teachers' retirement system acknowledges that as a complete year for the purpose of retirement credit. For your certified employee, or I'm sorry, classified employees or employees who are in the county employees retirement system, they will receive credit for a full contract year so long as the actual number of hours they worked is equivalent to the number of hours they would have worked in a traditional year. So, for example, if a school district employee is going to work an additional half an hour each day under the variable student instructional calendar, so long as that is equal to or more than the decrease in the number of days that they receive under that proportional calculation. If it's 5 days, if the district actually went 165 instructional days versus 170, then that employee will receive credit for a full year in the county employees retirement system.
Great.
Any
Thank you,
follow-up
Todd.
questions on that?
I don't think so. Tony, do you know if there are any questions related to this coming in? And Todd, if you'll stay on, the next one's also for you. May need to get your crystal ball out. This one has some and attorneys I know don't like to predict. So the next question raised by superintendents about needing specific information on liability exposure when you're recognizing, and we're all recognizing that a portion of the student population, or at least parents are, and we're seeing it when we go out in public, are refusing to adhere to the CDC guidelines for mask wearing and assume social distancing.
Yes, thank you, Commissioner. So I agree with you. Unfortunately, I don't have a crystal ball, and I can't fast forward and see how that would play out in a court. Of course, I can't give school districts any legal advice, and I would encourage them to speak to their board counsel for specific, fact-specific situations that they're dealing with. However, the information that I can give, if you'll recall a few weeks ago, I did give some information regarding considerations for district liability, and school districts have immunity and what that looks like, the elements that are looked at in order to grant immunity. The department has provided guidance and will continue to provide guidance that continues to provide school districts with some level of flexibility. And if you'll recall from the presentation that I gave, when school district officials have discretion in their decision making, the ability to look at a fact pattern, think globally about a situation, utilize their discretion and come up with a solution, as long as they do so reasonably, then they're typically entitled to immunity when they get sued. However, if from the state level we push down an absolute mandate to school districts that they must act in a certain way every time, regardless of the situation, that becomes what we call a ministerial duty, and there is no liability forgiveness there in the form of immunity if that's the case. So, recognizing that each school district has very unique circumstances, very unique fact patterns that they're dealing with every day, and they may need to treat these situations differently based on a number of factors: the way their facilities are arranged, the enrollment of children, the number of enrollment in children in different buildings. The department has attempted to provide some flexibility to school districts, and that is where they will use their discretion to set forth the guidelines in policies or standard operating procedures for their staff in how to respond in the situation, in this example, of students not wearing masks. And as they use their discretion, so long as they do so in good faith, we feel, fairly confident that hopefully the courts will grant them immunity in the event that they are sued. So keep that good faith and reasonableness standard in mind as you come up with policies or procedures for how you're going to handle mask wearing in your schools. Keep in mind that, on the one extreme, we have the reaction of simply ignoring students who are not wearing masks. That's probably not where we want to be from a reasonableness standpoint, given the fact that we have science to support this may be the number one thing we can do to stop the spread of COVID-19. And we've got guidance from public health indicating that that is a strong recommendation to stop the spread. So obviously you want to provide some guidelines out to your school staff, to building principals, and to teachers on how they're going to react in that situation. For example, taking a look to see if the issue is the student just doesn't have a mask because their family can't afford to purchase one, then we need to connect that student with some resources to be able to get them the masks that they need. If they're doing it as an act of defiance, probably step number one would be talking to the student and maybe their parents as well and explaining the science behind mask wearing, explaining that it's actually to protect other individuals, not necessarily the mask wearer. So all of the other students and staff in the school are depending on every other student and staff member in the school to wear the mask for everyone's protection, and equally importantly, to keep schools open so that we don't have spikes in cases of COVID-19. That's a very long answer that didn't directly answer the question because I don't think I or anyone else can directly answer that question. But that's probably the best information that I have at this point.
Todd, thank you. That's a great explanation. It's I think adequately explains it. It also raises, it doesn't mean that it emphasizes the fact that we're in a difficult time here. And, I've heard the governor talk about, and our friends at Public Health, because we do not have a vaccine, because we do not have a treatment yet, we know of 3 things we can do to stop the spread: wearing a face covering, washing our hands, and spreading out. And the unfortunate thing for school districts, and I talked about this yesterday on the Superintendent Advisory Council, right now, if you have a child that takes their shirt off or takes their shoes off, there's a societal expectation in our society that we wear shoes and we wear shirts, and that be adhered to in the school. And so your administrators, your teachers, your monitors, your instructional assistants are backed up by society when you take action, and that you're able to correct that easily. Washing our hands is a societal expectation, and that's not going to be, we know probably some students go in and say they wash their hands and they really don't, and they may not adhere to it for 20 minutes or 20 seconds. But we know that's a societal expectation, and that's pretty easy or easier to have students adhere to that. Where we're having problems is, unfortunately, I look at this on a scale, and way over here, you've got wearing a mask or being socially distant as being enforced through a state law or a federal law. And I don't think anybody wants that, and that's not where we are right now. Over here, on the other end of the spectrum, you have those 2 behaviors not being supported by our society at all, despite the best, or members of our society, despite the best recommendations from our health experts. And so as school officials, we're having to deal with that when students come to us. We know that that is what students need to do, have a face covering, and we'll talk about that here in a few minutes about when that's going to be necessary. We know that we need to have social distancing. We know when we can't be 6 feet apart, we need to definitely have a mask on. And right now, we're not getting those signals from other partners in our society and at other parts of our government. And that is going to make our job very hard to do in the fall, but that doesn't mean that it's not the right thing to do, and it's also the necessary thing to do. And unfortunately, that's where we are. We're going to be seeing pictures, I predict, of the UK basketball team, the U of L basketball team, the football teams wearing face coverings here in a few weeks. Because, first of all, they're going to have to do it because they're enrolled in those universities, and those universities are adhering to those same plans. And they also know, and they're being advised by team doctors and the coaches, that is what they need to be doing. And I mention that because the more images like that we can get out in public and on social media and on TikTok will be a small way to help you and to influence members of your community that at least while children are in school, this is going to be the expectation. And it is done so because that is the only thing we know to do to prevent the spread, and to prevent, most importantly, the spread to members of that child's family back home. Many of those are folks in our elderly population and grandparents raising grandchildren. I know you all know all of this, but it helped me to kind of look at things on a spectrum. And the unfortunate thing is we don't have a lot of support right now on some of these things as we do on some of the other things that we obviously enforce on a day-to-day basis. Related to that, superintendents are saying that they need specific information on disciplinary issues around refusal to adhere to health-related procedures. And Kelly or someone, could you all speak to the importance of building management and the importance of having procedures in place that district administrators can assist our building level principals with?
Sure, this is Kelly. And Amanda and Rob may want to chime in too, other people that have been principals. But, you need to kind of develop some guidelines for your building, and we don't want kids, of course, to be punished for not showing up to school with a mask or for not wanting to wear the mask. So I think this is a real opportunity for strong leadership to show through. We're going to have to model as adults. Our teachers are going to have to model for our students. We're going to have campaigns, as Kevin mentioned, through social media with your local community, with your basketball coaches, your football coaches, your cheerleading sponsor, working with the youth service center. So it is going to be a culture and climate issue, just like sometimes dress code issues can be, very much that we've all experienced. But we don't want to punish anyone or set anyone up for failure because they've refused to wear their mask or they have shown up without a mask. We're really going to have to change the climate and culture of our building where it's just the way we have school.
Just to piggyback on, this is Rob, just wanted
Yes.
to piggyback on what Kelly shared, and that I know that the vast majority of schools are part of some sort of PBIS program, and those three major tenets are safe, respect, and responsible. And I think that the mask issue is one that can fit very easily into that construct. That does mean that you're going to have your teachers pulling 100% on that. And I know that that's not always an easy thing to do, and that a rule is only as good as the faculty who will enforce it consistently and fairly for you. But I do think that helps to give you a mechanism to build that into your school climate and culture, as Kelly just said. Thanks.
And this is Amanda. The only thing I would add on to what my colleagues said is be preventative in nature. Just what Rob had said about PBIS. This is just like cell phone policies and things like that. They can either be a disaster or you can really make it work to the best of your ability. And every one of your districts and schools all have a unique culture and climate and expectation. And so it really is about the behavior and how far you're willing to go. And what you don't want to do is make this the thing that stymies all learning and opportunities for students. And you certainly don't want it to be where it's consuming all of your adult time as well. So really be strategic and also be reasonable. With that, have additional supplies. We talk a lot about back in the days when people required belts. Many of you probably may still do that. Do you have belts on hand for the kids who didn't have them? So it's the same type of thing. Do you have the supply for them if they don't have them? And what is your plan to have a preventative environment for that few who just aren't going to comply or have issues with that, may have sensory issues, whatever it may be? Think ahead on the proactive measures instead of the reactive measures, because the more you're prepared in the different settings, just like when you all handle peanut allergies, just like when you handle different behaviors, this is a new behavior, a new norm. And so we've talked a lot about this, and we just really encourage you to work with your teams, your school teams, to come up with the proactive universal procedures, things that you would normally do to be proactive and productive and inclusive in your school. So thanks for the opportunity, Kevin, to share.
Thank you. The next related question, I'll also ask Public Health to chime in, and I think we've already discussed this. This will come as no surprise, and we've discussed this in previous weeks, the 5 buckets that you've seen Public Health talk about, the 5 buckets that Public Health has addressed us before on masks, social distancing, temperatures. It will come as no surprise to you that the 5 buckets are informing the document that is going to be released tomorrow. There's really going to be no surprises in that document, other than you're going to be pleasantly surprised at the formatting of the document and how it's delivered. And we want to thank our friends over at KY Stats for that. And so the question, the other question, the last question, next to last question from superintendents, that we've gotten over the last week, and then we'll go into the general discussion, is need to understand if masks can be mandatory or optional. You're going to see that the public health requirements or the public health expectations for a healthy school require masks when students are moving. They require masks if you are unable to have appropriate social distancing in the classroom. For example, if a student is seated in a classroom and you're able to have social distancing of 6 feet apart, which you understand is going to be a challenge in some classrooms due to class sizes and then coupled with small footprints of buildings. If you can have that social distancing when class is going on, the mask can come down. If you have to increase the capacity of that classroom, and you can't get the 6 feet social distancing during class, the masks need to be on. And then the document tomorrow you will see with those expectations as an example, but you will also see best practices, those things that aren't necessarily expected, but the things that public health believes should happen if you're able to do so. And I just want to talk one more time about the mask issue. It unfortunately is becoming the hot topic. You can go on any news site and it's an issue. And I ran away just a few seconds to get one. This is actually a Kentucky Derby one, which we're going to be entering Derby season here in a few weeks, which is very odd to say. It's interesting how something this simple, a piece of cloth with straps or elastic, has become so divisive. And I'm not doing this to preach to you because I know you all get this and understand this, but I'm reminded behind my shoulder, I've got a clock of FDR, and I have that on there because our whole society overcame a great challenge. And I'm not attempting to equate this pandemic to what we face in World War II, but so many sacrifices were made in our country years ago in various things, rationing and victory gardens and all of those things. In our society, now we're focused on, we know this is the only thing we know of from our educated health professionals that can help us prevent the spread of a disease, and we're having issues, and we're even having some division among our own colleagues about this. I just want to reiterate how important this is and how we have to model it. I was reminded of this, how important we are as school officials. People look up to us sometimes when we don't realize it. I was at the dollar store here locally this weekend, and I saw someone that former Sunday school teacher of mine, And she saw me walk through the parking lot, have my mask on. Sean had his mask on. I guess you could tell from my eyes it was me. And you could see it go through her mind, uh-oh, I don't have my mask on, and there's Kevin. And she knows I work for the state. My point being, even that interaction with somebody who is my elder, it sends a message when we all have our masks on. I know you all are doing that in your communities right now, but it's going to take the entire community to assist schools and districts in implementing this. And I get texts all the time, and I'm getting them today, and we're getting questions about how you all are really up against a very hard sell in your community. And we understand that. It's going on in every school district around the country. We're hearing from our colleagues around the country. And so we have to keep plugging at it. We know it's the only thing, that coupled with hand washing and the distancing, that will help in this effort. And we know it's temporary because we know that there's light at the end of the tunnel. We have hope for a vaccine or a treatment. And so we have to get through this. That was a very long diatribe and answer on that question. Our friends at Public Health, do you have any further feedback on the issue of mandatory versus optional mask wearing in our schools?
Sorry, I was muted there for a second. Yes. So one of the questions is just kind of wondering along the lines of, and they're using the word mandating, but wanting to know, what happens if a district does not wish to mandate the use of masks, or does not want to use or issue the guidance around masks. What will happen? Or what's the alternative for that?
There's currently, we don't have a mask police, and there's not one at KDE, nor will there be. There's not one around the state. This is about expectations. It's about various entities of state government, school districts being an entity of state government, even though you're locally controlled, working together, doing what's best for public health. And so what could happen is, if there are lax policies in place and procedures in place at the local level to ensure that we do the best we can to ensure that students are wearing masks and staying distant the best we can. If you've heard Dr. White say on previous weeks, when feasible, when reasonable, use your best effort. I'm looking over here at my notes. Wear masks when moving. Masks can come down if you have the 6 feet distance, all of those things. And Todd talked about using best judgment, using good faith. All of those things is what is expected. So if you don't do it, you're not adhering to the expectations of the commissioner, of the State Board of Education, of the Department of Public Health, of the governor, of trained physicians. And you're out there, and you're going to open yourselves up to potential spread in your schools, and then contact tracing, and then potential closure if cases do develop because of that. Closure of an individual classroom for 14 days. You've heard the governor say several days ago, due to contact tracing, we are going to be able, if there is some type of an outbreak, or if one student has COVID and others have been exposed, we believe due to contact tracing, we will be able to drill down to that classroom, or maybe even to those kids that were around the cafeteria table, and not even the entire classroom. And then those children would have to be quarantined, not the entire school. That's good news, in that we don't have to close the entire school or district down, but we want to make sure that we're doing everything we can to prevent that first child from getting sick or spreading it in the first place. Our public health folks, Dr. White, do you have additional comments on that?
This is Dr. Meserly. I don't think Dr. White was able to be on today. Commissioner Brown, you took the words right out of my mouth. Absolutely, if a school district does not enforce students wearing a mask, it does increase the chance that they will have more of a spread in their school. I like very much how Todd Allen mentioned that wearing masks will keep your schools open. And I think that's from a public health perspective, that is true. schools that do not enforce the mask wearing will potentially have more of an outbreak. So I agree with what you said, Commissioner. Thank you very much.
All right. The next question, and I'll just go ahead because there was a comment about the compulsory attendance and just wanting to know, parents deciding not to send their kids to school because of a mask. If Commissioner, if you want to elaborate on this, but school attendance, whether in person or virtual, is still required, correct?
Absolutely. That was not going to be waived in any form or fashion, other than this is the first semester, probably in history, that we will be enabling you to educate kids, some in a classroom using social distancing and a mask wearing as appropriate, and others that normally would have been in that same classroom to educate them at home using non-traditional instruction. To my knowledge, that's the first time that has ever happened. Now, of course, the caveat to that, or the exception to that, is home hospital. But this is not home hospital. This is, we're not saying that you have to have a child has to have a doctor's excuse. We heard from you early on, and due to some very early surveys and a great out-of-the-box thinking by some of our superintendents, that you knew this would be an issue and that parents would want to keep kids at home, and you wanted to meet the kids and the parents where they are. That is a perfect example of the ingenuity and the spirit of our school districts in Kentucky. And so we wanted to meet you and meet you where you are and provide the funding to do that. And so that's what Robin talked about a little bit earlier about we're going to move away, at least temporarily, from attaching attendance to funding. We're going to flow forward the funding that you would have had in the previous school year in order to, and lack of a better term, keep you whole so that you can make those decisions that are best for your kids. If you have 10% of your second graders that are at home and you can deliver non-traditional instruction while the other 90% are in your classrooms, and we know many of you are developing plans to do just that, that's exactly what you want you to do. The fact that you're educating that child, or the 10% of those children using NTI, that satisfies compulsory attendance. Todd, do you have a further clarification of that?
No, I think you accurately touched on that, Commissioner. I just wanted to clarify in case there's some level of fear about students not going to school because of a district communicating with their communities and their families that masks will be expected of students to wear. Compulsory attendance remains in place. Students are required to participate in school, whether it be virtual or the traditional in-person instruction.
Okay. I'm looking to see more about masks. There was a question here. Let me just look. There was something about the face. All right, here we go. The one guidance document that we desperately need is regarding the requirements for masks and physical distancing. Is it mandatory to wear masks? If not, 6 feet apart? Some districts are saying they are not going to do that. Is this mandatory?
Dr. Meserly, Dr. White,
Dr.
go
White,
ahead.
I'm on the con. I was talking away to myself evidently a while ago. So I apologize. I've been on since 2 listening to your call. The very nature of the disease, the very nature of the virus, which we can't change, is that this virus is spread through respiratory particles. And when you speak, laugh, talk, sing, cough, sneeze, anytime you make a sound that comes out of your body, those respiratory droplets are going to, if you are infected, have tons of viral particles in those droplets. So if you are closer than 6 feet, you can infect someone else. If you are not wearing a mask and you're close to them, you can infect that person. So the safety expectations for your children and your staff are that if they are closer than 6 feet apart, or they're moving around where they get closer than 6 feet apart to another person, that a mask would be worn unless that student has some type of a medical reason for not wearing a mask.
Okay. The next question on masks is, can we order clear shields for each student and staff member, or do they also have to wear a mask? So the questioning is, I guess, on staff members, or can they order shields?
Well, a shield, if you've ever worn one, and when I was practicing medicine, I wore them during deliveries. A shield does not do much but just cover down to your chin. That does not cover the respiratory droplets that we're talking about. There are some masks that have clear plastic in them that are used for hard of hearing students. And if there is a medical reason that the child can't wear a mask but could tolerate a shield, that would be better than nothing at all. But a shield is not equivalent to a mask when it comes to blocking spread of this deadly virus.
All right, going back to recommendations for how to handle students who refuse to wear a mask or a face covering, they're wondering if we or they can offer a virtual option if they refuse to wear a face mask.
Well, you can offer, and many of you, if almost to a person, I think you're going to be offering virtual options. I asked for Kelly and Rhonda or Amanda and others and Rob to chime in here. I think that would not be your first option, is to automatically tell a student who doesn't wear a mask to automatically go to be virtually instructed. I would think that would be somewhat of a last resort, but I would, Robin or Kelly and Amanda, do you want to chime in on some management techniques regarding that?
Yeah, so it kind of goes back to your climate culture and your preventative plans for your universal procedures, is that most likely a lot of the kids who will refuse or won't wear it are probably the ones who desperately need to be in the classroom receiving instruction and support. So this is very similar to the different or difficult behaviors you all deal with on a day-to-day basis, and the strategic approach you take of being proactive and setting up a scenario that it does not prohibit students from learning, but it also doesn't, the best of your ability, not put anyone in danger. And so really, this is the time. I mean, Rob nailed it as far as really having your PBIS in place, of your behavior supports in place, your universal procedures and plans, even down to your classroom management of what to do in different scenarios, and really walking through what are the options, so it does not become just punitive or automatically sending them home. For many of these kids, it could be sending them home into a non-supportive environment or chaotic environment. And remember that a lot of these kids who are going to be coming back, as you all know, I feel like I'm speaking to the choir, are going to be having some trauma that they've experienced. And so I think you're going to see lots of different challenging behaviors that I would hate to see you just send them back home. I'll stop there and let my colleagues add.
Yes, this is David. There is a certain population in our CTE courses that are conditioned to PPE. So it's not like that or any different classes to say. It's that they're aware of the dangers. And even then, not all of them want to all the time. But it's like Kelly and Amanda and Rob have spoken about. It's about that leadership, that reinforcement, conditioning, letting them understand the reasons to do that, which along with that problem.
Okay. Similar question on the face shields. I just want to reiterate that this has been answered. It's been asked in a different way, and it's been like 9 times. Are face shields an acceptable alternative to face masks for students? They're easier to wear. And the answer to that was no. That is not acceptable alternative. Correct, Dr. White?
Yes, that's correct.
Okay. So that one is answered. Moving on to the next question. And I'm going to kind of combine these 2 questions because they are related to the Healthy at School guidance document that'll be released tomorrow. Will we, and that's superintendents, receive a copy of the Healthy at Schools guidance, superintendents only, And will we be able to respond before it's publicly released? And then the second part of that question, I'm going to scroll down to it because I think that this kind of goes with that question. Once the Healthy at School guidance is released, will it be the final document that we will use to reopen schools? They're saying that whatever the guidance, it needs to be consistent moving forward and not change on us. Commissioner, can you go ahead and address those two issues, please?
Yes, and then public health can come behind me to hit what I missed. So as superintendents, you have been advising public health and the department on this document for several weeks now. The reason we are 2 weeks behind when we initially had planned to, and public health had planned to release it, was because of feedback from superintendents and advisories about what you were seeing in other states, about formatting the document, about issues you had raised about getting on the bus and whether a temperature could be an assurance or whether it was on the bus. All of those things have been taken into consideration, and public health have been able to offer some flexibility on that, including reformatting the document to be very visibly appealing not only to school district leaders but also to parents. And so you have been advising those 5 buckets that public health that's been used by public health over the last few webinars are things that have informed and have populated the document you will see tomorrow. So you have seen, in essence, other than the graphics and some pictures of students and buses and pictures of a student at a water fountain and some shading, etc., you've pretty much seen it all. You've also asked for things to be best practice versus expectations. And that's also been edited in the document. We are having this webcast today and getting additional feedback from you because the document is still subject to be revised as late as tomorrow afternoon. It's being revised right now due to some changes that are being made based on the feedback of the Superintendent Advisories Council. So, in order for the document to be released tomorrow, it is very unlikely we're going to be able to release it to you prior to the governor's press conference. And I'm not sure the timing of when he normally releases the document. I think it's probably around the same time, Tony, as when he's having a press conference when some of the other Healthy at Work documents have come out. That is not likely. It is likely that that document is going to be continued to be refined based on this feedback we're sensing and hearing from you as late as tomorrow afternoon. The other part of that question was, remind me, Tony.
Is this going to be it, or is it going to be changeable?
Okay,
or is it going to be changed?
So there's a whole between now and around mid-July, you're going to have about 15 guidance documents. Tomorrow's document is the one of the 15. You've already gotten around 6 of those, or maybe 7 or 8 from the department on various things. One of them was the initial document that had guiding questions for you to ask your community and talk about setting up an advisory. And then we got into teaching and learning stage 1. This, though, I envision will be the flagship document. If you have kind of the one to lead all the others, even though it's coming out in the middle, it's the flagship document because it's from public health. And this is a public health crisis. And public health, they are advising on this is what we expect to have to open a public school building from public health. These are the nice things to have. And then that document will then inform the remainder of the KDE guidance documents. For example, in the document tomorrow, you're going to see 5 or 6 bullet points on custodial actions that custodians need to take for a building, or 5 or 6 bullets on sanitation of a bus. Well, we know it's more than just 5 or 6 bullets. KDE has or will have additional guidance documents that takes those public health expectations and then goes out into further guidance for school districts. So the answer to your question is yes, tomorrow's guidance is final. However, it is also subject to change, just as the Healthy at Work document has been changed as we have moved on in the pandemic, as statistics of the virus have changed, as the governor's office and public health have heard feedback from business and industry. This document could also change on certain issues just because of the nature of the unknown territory that we're in. But you're going to find that the document tomorrow gives you very clear expectations. There will not be any surprise to you. They're talking about the expectations we talked about masks when you're moving, masks when you're less than 6 feet apart, masks can come down when you're more than 6 feet apart and you're not moving. And then also temperature taking. So for an example, we believe we're going to be able to offer some flexibility on a temperature taking based on when you get on a bus. We know was going to be problematic, and knowing that when you get to school, maybe that's the best place to take it as opposed to getting on the bus. We're continuing to have those conversations. We think some flexibility is going to be able to be offered in the document tomorrow. That's all based upon feedback from superintendents.
Kevin, I also wanted to add too that something that KY Stats is also going to do that I think will be of help is they're going to develop some posters for school districts, and it's still being developed. I haven't seen it yet, but they're going to take the document that you will be receiving and that will be shared tomorrow at 4:00 and kind of creating, posters that you will be able to print out. And we are working with Jefferson County's language services department to have those transcribed into several languages. So these are all going to be available for you to download for free and to print out, to put up on your school buildings, to put in your buses in different sizes that talk about the 5 different buckets and that touch about this Healthy at School document. So these are going to be things that we're working with KY Stats. We're going to make sure that they're accessible for students that are blind or deaf, and also just make sure that we're working to kind of tie the two things together so that, again, if they need to be updated, we will continue to send you the updated versions of the posters so that you can work on getting those out. Now, will the posters be available in all 5 languages tomorrow? Probably not, but we hope to at least have the English version available to show tomorrow at 4 or whenever the governor releases this during his press conference.
Thank you, Tony. I see something, Tony, about a question in the chat about what if school district does not mandate masks. Did we cover that one?
Yes, we did.
Okay. I would just add to that, if you're having that question in your community, Todd talked about reasonableness, acting in good faith. I think we need to, folks that may be proposing that to you, we need to turn that question back on them and say, do you think it's reasonable and an act of good faith for a school district to not follow public health expectations and expectations of the Department of Ed? I mean, that's a way to also reframe that question.
Okay.
Tony, before you go on, there's one last question from the co-ops that I think I skipped. The superintendents need direction and not just questions to consider on what to do in the event a student or teacher tests positive for COVID-19. Do they shut a school down? We've touched a little bit on that today. Dr. White or Dr. Meserly, could you take that one?
Sure. When someone has a positive COVID-19 laboratory test, the Department of Public Health and the local health department where that person lives, not necessarily where they work, but where they live, is notified, and that's where contact tracing comes in place. That person who will be notified by their primary or the person who ordered the test will then be contacted by the contact tracers from the local health department, and they will have that's why they're called disease investigators. They will go through a long series of questions to find out where have you been, who have you been in contact with, how long were you in contact with them, how closely were you in contact with them, did they wear a mask, did you wear a mask, a whole host of different information to help them understand who is at high risk of having transmitted that disease to them, and who is at low risk and doesn't need to go into any type of quarantine. So if someone is high risk and is quarantined, then the contact tracers will let those people know that they need a 14-day quarantine. So your responsibility as educators is to try to assist in a child's case of what that bus manifest was, what that classroom setting was, what that seating was in the cafeteria. Those kinds of things will help the contact tracers minimize the number of people inconvenienced by quarantine, but the correct people are quarantined so there's not more spread. So one case in a school does not close the school down unless there's not social distancing, there's not mask wearing, there's not temperatures being taken. This in itself can help to close a school down. And I know that is certainly not a goal for anybody on this call.
Okay. Next question that we have is, will we have to, can you hear me okay?
Yes.
I apologize if you hear some banging in the background. My husband is putting in hardwood floors, so I'm trying to mute myself so you all don't hear that. But the next question we have is, will we have to take temperatures daily, or will we trust guardians to accurately report? And so I think there's probably two answers to this question.
I'll start it and then we'll defer to public health. Dr. White, as I said yesterday, I'm trying to be an amateur public health official here, and I'm learning a whole lot. It's my understanding that taking a temperature is one of the key tools that we have to slow the spread down, and then also to assist in contact tracing and to not introduce someone that could be sick into the building. And can you give us additional feedback and details on that?
That's absolutely correct, Commissioner Brown. If someone is starting to have an elevated temperature, and we're finding that of the people who are symptomatic, not all are, but of the ones who are symptomatic, almost all of them have an elevated temperature. You can catch that person at the door, entering the school bus, entering the school building. That is your best bet to prevent that person, whether they're a student or a faculty member or a staff member, from spreading COVID-19 throughout your school system. So that is that temperature taking and wearing a mask to prevent spread, especially among the asymptomatic, are two of your bigger tools in our public health toolbox, along with the social distancing. And something that was said earlier when it was talked about public health expectations, we very clearly named them public health safety expectations. This is not some person in an ivory tower somewhere saying, golly gee whiz, this would be great. These are safety expectations for your staff and your students so that you can prevent spread in your community. So that you don't end up as one of those counties on the map. I'm hoping you've looked at our website so you can see the high numbers. So by doing what you're going to be doing, you are going to prevent spread in your community, which is, I know, a goal of every one of you on this call. So those safety expectations are critical for your students and staff.
Okay, I have two questions related to meals. The first one is kind of just on instructional time. So the first one is, will we be able to count the extra time needed for meals towards instructional time?
So this is Robin. The extra safety requirements or the cleanliness requirements really cut across more than just meal service. You're going to have additional time that you're going to have to spend probably taking students with social distancing to the restroom and in the halls and all that. So we are taking that into consideration as we talk about what that looks like in your school district. I don't think we've landed on the exactness. But we do hear that is just as a practical matter, you're going to need more time to do some of these things that would typically infringe on instruction time. So I don't have an answer for that right now, but we are listening and hear that as a practical concern.
Okay. The next question is coming from a superintendent. I'm concerned that in the grab and go meal model, we will, by necessity, have to serve mainly cold meals to students. How can we implement grab and go, but not also provide hot meals?
This is Katie. Go ahead, sir.
before you start, I'd like to make a comment on that. I realize that's very important. I went to an elementary school where we had fresh homemade yeast rolls and shepherd's pie and homemade butterscotch candy. And I know that's not in keeping with the food requirements, but I understand the importance of hot meals. And I know we had this discussion several weeks ago. As good as the summer feeding is, we know that majority of that right now, particularly during a pandemic, prepackaged foods, and while still meeting the meal requirement, it's prepackaged food. So we understand that. Public health heard that concern, and I believe there have been some allowances that have been made for the option of going into the cafeteria, and I think that was alluded to in the presentation on food service. That will be further elaborated on in tomorrow's guidance and then in the additional guidance from our food service folks. Did I say that, Katie and Jennifer, correctly, and Dr. White?
Yes,
Yes.
that's correct.
And this is Katie. We are aware of that concern as well. So SCN is working on sample menus. We're working collaboratively with the Department of Agriculture to include commodity use as well. But we're working on sample menus for meals that can be served in the cafeteria as well as grab-and-go options. And we're going to try to give suggestions for packaging, necessary equipment, and transportation suggestions for those things. It is important to check the equipment that you have available to see if you need to purchase. There are carts and kiosks that you can purchase, and those are allowable expenses to the food service account.
All right. Our next question is wanting to know if we will be, Katie will be submitting a waivers for state assessment and testing for the 2021 school year.
It's my understanding that's being discussed by the U.S. Department of Education as they are continuing to hear from states and our national organizations such as the Council of Chief State School Officers and others as to the potential of that being necessary. We have said from day one, at least while I was here as interim, that we plan on applying for any waiver and taking advantage of any waiver offered federally, not only from U.S. Department of Ed, but of course through U.S. Department of Agriculture as well for food service. That's certainly my position now, but my time is quickly coming to a close as an interim. My guess is that the new commissioner will have similar feelings and understand this is going to be a most unusual year, and we'll want to have that discussion with the State Board of Education to take advantage of a waiver of the K-Prep testing for the spring of 2021 testing. And so I believe that that discussion is coming. We do not yet know whether USED will entertain those. I have heard, and this is because I have nieces in Georgia, I think the Georgia Department of Education has announced they intend to apply for a waiver of their tests, their standardized tests for next year. So my guess is the majority of states will apply for it, and we'll just have to wait to see how those are received by U.S. Department of Ed. If waivers are granted, I do think we have to think differently about what that means. We obviously didn't have tests last semester. We shouldn't have had tests, and we were focusing on feeding and educating and supporting to the best we could. When we're going into a full school year, I think we have to, and my guess is the U.S. Department of Ed will want, and I think our General Assembly will want, and others in the education community will say, okay, if we're not going to have K-Prep testing this year, what other types of diagnostic, formative, other types of testing can we encourage school districts to have to address learning loss, to address the gap, so that we are still measuring where our students are, it may be even in a more informative way for that specific student, even if we are not getting the K-Prep data back that is judging and informing us on how the school is doing as a whole. So that is my prediction on how that will play out. And I encourage you to, and I know you're already having conversations about how you best gauge students where they are and their learning loss and how you address that over the upcoming year. I think that will be part of that conversation. You're muted, Tony.
Sorry, I was trying to keep the pounding from going on and forgot I was muted. I have a couple of questions. It looks like Dr. White has joined us on the video. So welcome, Dr. White. the questions on safe cleaning products and sanitizing. And I do know that we have a couple of guidance documents that are coming from KDE on these areas, but I'll go ahead and ask the questions. Will we receive any guidance for safe cleaning products to use during the school day? And the second question is realistically, how are districts going to sanitize buses this fall and turn them around so quickly every day?
So Kevin, this is Kay Kennedy. And the guidance relative to facilities, which does include cleaning and sanitation, is planned for next week. In the interim, I will tell you that we are referencing the product list that's on the CDC website for cleaning and sanitization. There is a difference between cleaning and sanitizing and disinfecting, and that has to be considered for different spaces in your school buildings. For example, you can think about sanitizing the tops of flat surfaces like desks, but you may want to talk about disinfecting in the restroom or other places like that. So to the extent that we have knowledge of those acceptable products based on the guidance that is currently on the CDC website, we will be directing folks to that. We also ask that you examine the current products that you use for the contents that may already be addressing the needs for sanitization versus disinfection. So take a look at that, as well as which of those products require use of additional PPE that your custodial staff or other folks who are involved in the sanitation, for example, on the bus side, if the products are of a nature that additional PPE needs to be used, you should be aware of that as well. Now, with respect to the bus, the turnaround on buses, again, it depends upon the schedule that you're going to be transporting students. But the use of certain cleaners that you can wipe down and get that level of sanitization as opposed to disinfecting is probably more appropriate for the bus. And to get that wiped down and turn around really depends upon the schedule and the fact that you may need to enlist additional assistance for folks to get that accomplished really depends upon the schedule that you have to run. But we're addressing the bus cleaning and the bus sanitization in the pupil transportation guidance. We have direct reference to the specific bus manufacturers who are on contract to the Commonwealth of Kentucky. They've all provided us with guidance relative to how to safely clean the buses, so that will be coming forth next week as well.
Okay. The next question I have, make sure I'm not muted. Okay. Next question I have is, will employees be required to use sick personal leave if they are absent due to COVID-19 diagnosis or exposure quarantine?
Todd, can you take that? And that may also bump up against the FMLA issue.
Tony, do you mind to repeat that for me?
Sure. Will employees be required to use sick/personal leave if they are absent due to COVID-19 diagnosis or exposure quarantine?
As I understand, the employee would have the option of utilizing their accumulated leave that they would accrue under traditional circumstances, but they may also qualify for the leave that has been put in place by emergency federal legislation. And we covered that on a few webcasts ago. I can pull those slides and we can send them around again, but there are certain provisions that were put forth in emergency federal law that provides employees some ability to utilize leave time in the event that they are advised by a doctor that they should self-quarantine or that they are subject to some type of quarantine order. And as I understand it, the employee could could choose which leave type they use, whether the traditional leave type that's provided under your current board policies, or whether it would be that federal leave that has been provided by emergency federal legislation.
Okay.
Tony, I'm getting several comments here on my text from superintendents. Some of these two are related. And again, commenting on the amount of time that it is going to take staff to, for example, if they have to have staggered bus schedules because they need to do so, just like you're bringing planes into an airport, you don't bring them all in at the same time because you have to have the gate crew to get them offloaded. And if they're they're going to do temperature checks. And so the point being there, and from another superintendent about flexibility that may be needed related to time and length of day and staggering student arrivals. So I don't know that we have an answer for that other than we're flagging it. I do want to make sure you all understand that we're not, this isn't an end of looking at flexibility tomorrow when this document comes out. We're still open for business at the department, and we're going to continue hearing from you. We're going to continue to have webcast. Public Health agreed to continue to come on a regular basis to hear how things are going. And that doesn't mean that we're going to all of a sudden just say you don't have to wear masks anymore, but want to make sure that as we continue to go along, we're first trying to take care of the big issues, but as we continue to get closer to the school year, we very well may see that we need a waiver of this, that, or the other related to next school year. So just know that continue sending us that information, even though it may not be in tomorrow's document or in the waiver package you see tomorrow. Know that this is a rolling process.
Okay. Questions related, will there be guidance about specialist teachers such as science and art going into classrooms to work with students?
I think initial guidance from Public Health was in an ideal environment, you're going to limit the amount that students move around, and it's best to have the adults move around from classroom to classroom, knowing, though, however, that is not always logistically feasible. And Dr. White, we do have a lot of teachers that come in and come out and operate from carts, etc.
Okay. And the least amount that can happen, but I know it has to happen. The least that can happen, and the better. And then when it does happen, keeping that manifest so we know what students were exposed to that teacher or what teachers were exposed to that student is critical.
All right. Next question that I have is going to be from, relating, sorry, it just got moved. I had it marked. Do the mask and social distancing requirements effectively end any discussion of continuing sports, or will we be dealing with different rules for each? This will make the academic requirements harder to enforce.
We know that Commissioner Tackett is very much involved with talking to Public Health, the governor's office, in addition to legislators and, of course, the Board of Control. Commissioner, are you on? Do you want to briefly handle that? Of course, he can't speak. No, he can't speak. He's on the other one. Or is he? Commissioner Tackett is on the case, I can assure you.
We can flag that because I think he was talking about coming back on to a webcast, so we can put that on as a future agenda. Okay.
Let's definitely do that. I know he's very active in a lot of this, though, understand things are changing, and I'm not saying one way or the other whether a sport is going to happen, but, there's conversations out there about when is the best time. Low contact sports have generally been green, have a green light, but then the other contact sports are problematic. Hearing that a team from Clemson, I think 20 to 21 of those individuals are positive. Hearing, obviously, if you watch the news, hearing some things about spring training down in Florida with Major League Baseball. And so, this is going on, and these decisions are in flux because in the professional world as well as in high school and youth sports. So we're just going to have to stay tuned to that. We are working alongside, of course, KHSAA, and I know that they are very engaged with the appropriate folks at the DPH and the governor's office.
All right. The next question is, what is the current recommendation regarding testing of faculty and staff before and after the school year would begin?
I'll defer to public health. I can tell you that the governor would love to see a goal of about 10% of your staff tested per week. We know that our insurance plan covers, for the most part, free testing. We know we have a lot of testing sites around the state. And I know that that is certainly a goal, and that's also a prevention measure. And Dr. White, I'll defer to you for the rest of that.
We did not address in the document about testing. I think that's, as the commissioner said, that certainly would be a goal, but we did not delve into that. We do know that there are a certain percentage of people that are asymptomatic, so having that testing would be helpful for you. But again, getting back to the masking, that is why that is so important. I mean, this little piece of cloth and these two rubber bands, just as the commissioner said, could stand between me, if I'm an asymptomatic carrier, and getting someone sick. And I can refer you to a pretty cheerful video I saw of someone who held up a mask and said, if the person that breathed on my husband had worn a mask, he would not be dead right now. And I know that's very dramatic, but it's true. In the 2 hours we've been sitting here, I've gotten 3 requests for remdesivir. Remdesivir is a medication that has been sent to the states through the Departments for Public Health, and it is a medication you give people who are extremely, extremely ill, and it will decrease their time in the hospital by 3 days. We don't use remdesivir very often, but we have people in the hospital right now that are sick and desperate enough to need these medications. So a piece of cloth over your face is going to keep potentially someone from dying. I think that's a very minimal price to pay. And the question I got yesterday at a webinar, what's going to happen to people who got COVID-19 and recovered? What kind of long-term effects are they going to have as far as lung damage or any other multi-organ failure? And we have no idea. So I think we're asking people to care for their fellow Kentuckians and protect each other. That's the best thing I can say about the masks. Sorry, I got a little preachy, but I get wound up.
No, that's okay. So Julian just texted, and he said that masks will be in their guidance document. All the CDC documents do not indicate aerobic activities will be being required to wear, as well as the youth sports docs. So the CDC says it's not the same for participants and non-participants. So they will clarify. And I am checking with him on when he will be able to participate on another webcast. So I think he is able to listen. He's just not able to respond at this point today.
There are additional questions coming in, Tony, that I see from superintendents about the release of the document and about not having the opportunity to provide feedback. Let me just be very clear. We have worked with numerous advisory councils with this, bringing back the Superintendent's Advisory Council and having a superintendent webcast for every week as far back as I can remember. We have done our best to include public health. They have done their best to present the buckets of requirements that will be in that document you see tomorrow to you, and you have had time for feedback. That document has changed based upon feedback from superintendents in this webcast and superintendents yesterday on the advisory webcast, feedback from the the Education Continuation Task Force. We want to get the document out tomorrow, and we are using today's feedback on this call, the frustration that we're continuing to sense from you on certain issues, to advise the final version of that document. It is not intended to be a slap in the face to superintendents. We are trying to do the best we can to get the most feedback that we can and to deliver it to you in the best manner that we can.
So a lot of the questions, and I'll reiterate, so after each of these webcasts are done, and I'll provide this as a follow-up on that. We do archive all of the questions that are asked by all of the superintendents, and they are archived, and we are working on providing that update, which should be up and live by the end of this week. All of those questions that you all have had regarding all of the guidance documents and every question that you've had for the Department of Public Health and for Dr. Stack in relation to the establishment of this document have been documented, and they have been addressed. I know that in our KDE leadership team meetings, and also through DPH and at Lieutenant Governor's office as well. And the document has been is being tweaked as far as I know, and that's what it's going to be tweaked tomorrow as well. It's why we don't have the posters ready for you all, and they are going to be in the 5 bucket areas. So I just want you all to know that we do have the updated Q&A that will be provided for you, that will have the answers that were provided, even the ones that we do say that we'll come back to you with as another source of information on our COVID-19 page. Those are answers that were provided by KDE staff and also DPH staff, just as another resource for you. And we have been holding the webcast since, I believe it's been, I'm trying to think back, our first one was actually with Dr. White and Dr. Meserly. That was probably the 1st of March in our tiny little green room at KDE. And we'll continue to do this every week. So going to our next question, is there any guidance on getting students back into the regular school setting after they have enrolled in a virtual academy or online classes?
I don't know that we have guidance yet. I know that will be coming. I know, obviously, we hope that, some of the desire from some parents and students will be just the fear of the unknown once they see maybe their neighbors going to class and getting on the bus, and it may become more normal. And then maybe after a few weeks or a few days, they decide to come back into in-person. But we know there may be others, particularly if they're living with folks in their household that have medical conditions or are in a fragile state, that they want that entire semester. But we certainly, Kelly, I believe that's on your radar screen, Kelly Foster, already to provide that type of guidance, knowing that will be an issue of bringing students back.
Also, Dr. Park, are you on? I think you had also had a response, Dr. Marty Park. He had texted. I don't know if he can hear. He might just be able to listen in. He says they are working to establish some additional help for school districts who want to expand their online and virtual course offerings, and we'll be working with districts every day on this. And they're committed to working with individual districts on also reestablishing and helping schools as students are working to get back into the classroom. So, Dr. Foster, did you want to elaborate?
Just that I'll make note of that to make sure there's some guidance around transitioning back and forth.
Okay, great. A question on guidelines being considered for band and chorus classes.
I believe.
This is Kelly again.
Yeah, Kelly.
KMEA is actually working with Public Health on developing some guidelines around that. Dr. White, I know the president of KMEA sent those to you. You might be able to give an update on where you are with those.
Yes, that was, I looked at that document and I believe I sent that back yesterday to them.
Okay.
I've done a lot of assessments and sent a lot of things back. So if you check and I didn't do that, please let me know. But I'm pretty sure I did do that Monday morning.
Dr. White, this is Robin Kinney. You did send it back, so I think that has been returned. I know exactly how you feel, but that has been returned, and I think the question is next steps for them, if any. So we'll help coordinate that with them.
Thank you.
All right. The next question is, can we request a waiver of instructional days and only require the 1062 instructional hours? No district wants to forfeit potential quality days in August for in-person classes.
Robin, and I'll ask you to follow up. We have had this discussion about trying to balance between decisions that need to be made now at the beginning of the school year, knowing that the General Assembly will be coming back in January, and then knowing that's the halfway point of the school year, to maybe address the 170-day issue. And as of this point, we were erring on the side of that being a decision that needed to be handled in the early part of 2021. But we are obviously open to hearing feedback and problems that might cause you even early in the semester, early in the school year. Robin, is that an accurate statement of kind of where we are?
That's correct. And as we are talking more today about the impact of the extra safety expectations on instructional hours and the tie to the 170, I think we can revisit all that. But I think where we had left it at our last discussion was letting that play out a little bit, letting school get started, and see where we were a little later in the school year.
Okay. Next question is going to be around, there seems to be some people continuing to ask questions about face shields. And I just want to make sure that in case we have some people that are late joining us, that Dr. White, if you can just reiterate that the face shields are not acceptable as a replacement for the face masks. Can you just go ahead and reiterate that for us, please?
Sure. The face shield will not provide the same protection by blocking respiratory droplets as a mask does, so they are not equivalent and one cannot replace the other. The only time a face shield would be something that would be acceptable is if you had a situation of a student or a staff member who had a medical reason that they could not wear a face mask. But wearing a shield is not equivalent to a face mask.
Okay, thank you. We have a next question is, will students and staff who are sent home with a fever be required to get a COVID-19 test?
Well, the expectation, I would think, on the part of the school system would be somewhat a person, child, or a student or a faculty member or staff with a fever. You want to be sure that's not what they have. So they would have to contact their healthcare provider to get that verification that they could come back to school because they were COVID-19 negative. And I would think you would want to make sure that they were flu negative as well before they came to school, but that's not addressed in the document.
Okay. All right, next question that we have is going to be related to has KDE considered providing districts an online K-12 program, in parentheses, online lessons for core subjects? Teachers teaching kids both at home and on-site could supplement it for teachers at home as a suggestion.
Just as and I'll defer to Dr. Park if he's on, as well as others on that. There are some technology solutions. We're going to be able to use some CARES Act funding for some enhancements to Infinite Campus, for example, for online registration. Just from a historical perspective, KDE has had at best mixed results over the last 20 years of providing state level online learning resources. And so there has been some discussion of that, but then also learning from low usage rates of that in the past. That obviously affects, I think, our judgment and affects our belief as to whether that'd be a good use of resources, particularly when we know there are a lot of other competing resources out there that may not be utilized even if it were provided by the state. And I think I'm understanding that question correctly. David Couch or Dr. Park, any others comment on that issue?
Well, this is Amanda. I will comment on the agree with you completely, Kevin. I'm encouraged by what Dr. Park and David Couch's team has been working on, and we're working with districts. But as far as curriculum development, just as a reminder, we don't do that. That is locally decided. And to your point, when we have had programs and things in the past, they've had very low usage because it's kind of in isolation. It's separate from the curriculum that is developed at the local level and at the school level, quite honestly, which is what SBDMs oversee. So we don't have the capacity, honestly, or the oversight to be able to develop a full curriculum, and it honestly would not be appropriate because each school determines how the standards will be taught, and it is done by grade level, but a lot of it is driven by the local district to decide how it will be taught and what content will be used to teach those concepts and skills.
Okay. And Dr. Park texted and said that you got it absolutely correct, Kevin. So.
I'm telling you, I'm learning.
Right. Might have to stick around a little bit longer there.
Oh, man.
Sorry, this question just got up. What happens when a student shows up for the bus and doesn't have a mask and they are a minor and their parents aren't at the bus stop with them? Do we send them home, let them on the bus? Same would apply to temperature checks if they are over 100.4.
Kevin, this is Kay. We have addressed that in the pupil transportation guidance, but the sort of in a nutshell, you cannot abandon a student at the bus stop. It's best to be able to isolate the student on the bus as much as you can up toward the front. And once this child gets to school, have a protocol in place to get the student to a place of isolation and contact the parent, just as you would if a child was sick at school. So the idea is to, once you recognize that a student is exhibiting the fever, is to try not let that child mix among the other students as much as possible, and then do what you normally do to get the child to home or some other care provider as quickly as possible. We also do not advise keeping the child at school or letting the child travel back home with a fever. If a fever is identified during the day, have some kind of protocol in place to notify the parent or guardian and be able to get the child to home or some other caregiver.
Okay.
And something else that would be prudent would be to have some masks there on the bus for a child that is getting on the bus but does not have a mask with them.
Okay. Is there any flexibility within the 6 foot minimum? If we could use 4 feet and have students facing away from each other, we could potentially meet that threshold in an average classroom.
Well, the initial flexibility is that you can have them closer than 6 feet if everyone keeps their mask on during class. Now, I guess this goes back to geometry days. There may be ways to configure desks while keeping with the public health guidance that gives you some extra students in there by maximizing your 6 feet around. I guess it's the difference between the circle and a square. I know we've had those discussions before with public health, so there may be some leeway there. Dr. White, do you have further comment on that?
Well, again, it gets back to, we know that it takes about 6 feet is the usual distance. I think maybe 5 is the distance, and they've added a foot that you're going to have spread when there's vocalization, and the deeper and louder it is, the further that's going to transfer. So the 6 feet is a standard recommendation of that they need to be 6 feet apart. Now, if you want to put them 4 feet apart and face them away from each other, as you were talking about, that's an extra best practice. But the safety precaution, the expectation is 6 feet apart or with masks on. So if you want them 4 feet apart, if that's what you need to fit into your space, and I know this has got to be incredibly difficult, then that can happen if they're wearing a mask during the class time they're in that room.
Okay. I just wanted to do a time check. It is 4:03. We do have just a few more questions to go ahead. I mean, do you want me to keep going with the questions?
Well, that's always, we try to do that. I think I want this of all weeks. This is an important one. So I know, Dr. White, you may have to jump off, and we'll do the best you can. If you or Dr. Measley have to jump off, but let's try to go a little longer.
Okay. There is a clarification on the temperature checks because they're saying that regarding temperature checks conducted at school, the CDC states that schools are not expected to screen students or staff to identify cases of COVID-19, and they're wondering if parents can take the temperature before school. Again, I think that we addressed some of this with the flexibility answer, but if we can go ahead and touch on this in terms of before getting on the bus, correct?
Yes, what we decided was that the teachers, the parents or guardian can say that the temperature is less than 100.4, and they can get on the bus, and will wear a mask on the bus. And then when they get to the school property, there will be a temperature check. But this would prevent that concern that educators had about kids standing, waiting to be checked before they got on a bus. It eliminates the need for extra bus monitors. It eliminates the concern about safety of a bus driver actually doing those temperature checks. So if the parents can attest that they will check the temperatures every day, then the children can just go ahead, put on their mask, get on the bus, and then have a temperature check at school.
And that this is an example of the many times that we have talked with public health and we're able to reach some type of solution like this. But understand, when you reach solutions like this, there are consequences. So, for example, because that isn't going to be an allowance, if the student then gets to school and has a temperature and then ends up perhaps being infected, that increases the number of students the child was exposed to for contact tracing to that entire busload of kids, as opposed to the initial exclusion if they had a temperature. So, and that's fine, that can be done. It's just an additional amount of potential exposure and resulting in the contact tracing. But we also understand the huge lift it was going to be to have to check temperatures upon entry to a bus. And that's still a best practice if you have a monitor. But we also know many do not have monitors, and some of you have them and they're dedicated to a certain child because of a health condition. And we also don't want to ask our bus drivers to even turn this way to do a temperature check and take their eye off of the mirrors and the road. So that's a good example of some flexibility given, but knowing that when there's flexibility, there's also some other consequences.
Okay. Questions about the cafeteria. Will students be able to eat in the cafeteria, or will food service operate under two different systems to ensure the virtual students have meals, or will everything be operated under one system?
This is Katie. Correct me if I'm wrong, my understanding of the question is you are asking if in-school meal service will receive the same reimbursement as virtual meal service. Is that the essence of the question?
Well, they didn't ask specifically about reimbursement, but I think that's where they were getting at in that second question. And I think yes, if you want to take that question.
Yes. So at this point in time, we are working with USDA in hopes that National School Lunch will be able to provide meals during NTI virtual learning days. But at this point in time, we do not have that flexibility. So it should operate under the National School Lunch Program in school session. But we are very hopeful to get that ability through waivers, and we are writing state waivers to be able to provide that.
And this is a issue of that's occurring across the nation, of knowing that there will be some students that don't return, but we want to still educate them and then also still feed them. I read a statement by the Texas Commissioner of Education. Other states are also dealing with this, and so USDA is going to be hearing from the other states that we've got to have this waiver in place for the upcoming school year as well. So I feel pretty certain that it would be granted.
Okay. Our next question. They're wondering about the science on providing the cloth masks. If that can be shared, they're thinking that might help parents go along with it on if the cloth masks are being effective.
Oh, I'm sorry. Go ahead.
All I was going to mention, Dr. White, is in our facility guidance, we also make reference to a site under CDC that has printable signage that you can print at your location. You might want to then laminate it or something like that and place those around. So it's not only about wearing masks, but about washing hands and social distancing. So there is a lot of free material available. Or if you want to make it a project for some of your art classes or whatever, but there is free material available in addition to what Tony mentioned earlier with the poster that's going to be, I think, directly related to the graphics used in the Healthy at School document. So there is generic material available on the CDC website.
Right. And I know one of our cooperatives, Nancy had shared with us that, they're working on creating videos and working with their media partners to air kind of like PSAs. She shared a video with us. I'm hoping that I'll be able to get it into the PowerPoint for next week to kind of share with you all, some of the ideas that are being shared, because I think that might be helpful. As I know some of you are, you're tiny districts and you don't have a communications team and you don't have, you don't have a huge budget and stuff. So that's what we're here for. We're going to try to help you, connect you to different resources and different things that, that perhaps can be useful in conveying these messages. I've also talked with perhaps getting, the tourism cabinet with the Lieutenant Governor and other people involved with trying to get, messages conveyed, also using the UK, U of L, and different state college athletes involved in conveying the importance of wearing the masks and also modeling, having adults in communities modeling the importance of masking. So, certainly we know it's not a easy task to go in and ask people to wear masks when you don't see a large majority in your community doing so. But in order to have our schools reopen, it's just something, we don't want to be in a situation where this spreads and more of our children and more of our vulnerable population get the disease. So that's kind of what we're trying to work on. And we'll continue to provide those resources, video links and ideas and different, and if your community and your district is doing something or have ideas, I'm certain that, we can connect you with, different platforms and different media outlets that would be willing to work with you on that. So that's just another idea. So if I can get that worked into the website and share that with everyone, I will certainly send that out later today.
I believe, Tony, the mask issue should be the first topic of conversation at the first meeting of the Commissioner Student Advisory Council, which we'll be naming soon.
Yes, very excited about that. We have about 17 openings on that, and we should have, I will say, superintendents, very, very impressed with the number of applications that we have that have come in. And I will say that we will be having probably 2 representatives from all 7 board districts, which means that, you will be well represented from each of your districts across the state. Very impressive group of students. We are working on finishing up the process on that and hope to name our student representatives on our student advisory committee, the ones that are our council, the ones that are from the graduating seniors here within the next couple of weeks. But I've been very, very impressed with this group of student leaders that are incoming 10th, 11th, and 12th graders. So very vocal.
If you think a superintendent advisory meeting is tough, you ought to go in front of the students. I know you all know that well because you also have your own student advisories. I've always enjoyed it, but I found it to be one of the most challenging ones just because they keep you on your toes and they have so many great thoughts and ideas.
All right, next question. Is there any update on a possible executive order providing flexibility around a duty-free lunch for teachers?
We've had some general discussions about that issue. Robin or Todd, I think we have come down on guidance in lieu of that, talking about how that can be arranged using other staff. Is that correct?
That's correct. Either using other staff or utilizing the other spaces in your building that you might be able to use along with that social distancing. So I think we've come up with other options. Still not, we'll leave it up to the local district to decide which option best fits their needs.
But having said that, as we said earlier, as you keep moving towards the beginning of the year, if you start playing this out and you're staffing out and your building footprint out and it's becoming an issue, then we need to continue talking about it, about if other relief or flexibilities need to be granted in that area if the other options are not working.
All right, there's two questions here on the boat dock bill. One is the boat dock bill is based on those who work during, quote, school term. Does that mean every employee or only those that work when students are present? And I'll wait to get that one answered before I go to the next one.
This is Todd. I'm not sure that we have a real clear answer on that based on any type of court opinion or attorney general's opinion. The boat dock bill really hasn't been used that much, and therefore we don't have a lot of legal interpretations on it. So no court that I'm aware of has interpreted that. I'm not aware of the attorney general issuing an opinion on that just because it's been a provision that really it hasn't been used up until this point. The way I understand it, contracts based on the school term are those that you need the staff there when students are there. That's my very kind of general understanding of it. But again, we don't have any official court opinion or guidance from the attorney general on that topic. So teachers, for example, who are contracted to be there based on your school calendar to be present when students are present, those are typically the type of employees that I think of as ones whose contracts are based on the school term.
Okay. And then the question next to it is on the proportionality of the contracts and boat dock bill. Does the crediting of days occur in all job titles or just those surrounding the 170-day work calendars?
I'm not sure I fully understand that question. Will you repeat that again, Tony, just so I can see if I follow along?
Okay, on the proportionality of contracts and the boat dock bill, does the crediting of days occur in all job titles or just those surrounding the 170-day work calendars?
I'm going to attempt to answer this, and whoever asked the question, if this doesn't fully answer it, please email me and we can talk further about it. As I understand, the boat dock bill applies to provide 170 days of proportional credit to any contract employee, whether certified or classified, whose contract is based on the school term. Again, like teachers, paraeducators who may be assigned to work with students. If that doesn't answer the question, please follow up with me, and I'm happy to provide some additional assistance.
Okay, sounds good.
Todd, while you're on, I don't expect you to answer this, but another issue came up we need to flag for follow up with this superintendent and maybe even putting in our Q&A regarding classified employees and then the interaction between various labor laws on overtime and whether or not banked time can be applied to certain classified employees. Again, that's a very specific and get down into the weeds question, but a good one. And I'll forward that to you and know that may also be an issue in other districts.
Okay. I'm looking to see what else we haven't covered. There's a lot of repetitive questions here. Will the guidance address number of students together in a group or class, as DCC did for early childhood? I guess in terms of how many students will be allowed in together.
So the classroom piece is knowing that the majority of time students are in a four-wall classroom. That is the numbers are going to be dictated by whether you're able to meet 6 feet social distancing, or if you're not, then having the masks there to get you that classroom number of closer than 6 feet. The assemblies, I believe, Dr. White, there's some recommendations about avoiding school assemblies unless social distancing can be afforded. Is that correct? To the extent possible?
Yes, that's correct, because then you get into the governor's no more assembling more than 50 people. That'll go into effect next week.
Okay. They're wondering if desks can be facing each other less than 6 feet apart as long as masks are worn.
Yes.
Okay. Answer on that was yes. Okay. All right. There was a question here that just said, just received an email suggesting all of our school staffs watch an active shooter training video together. Can KCSS and School Safety Marshal work with KDE on providing uniform suggestions on group trainings?
Yes, we'll be working together. We are working together already. There are several issues that we've talked about already that are conflicting between public health and school safety in a traditional school year, and we're working to bridge that, and we will certainly make sure that happens with that training. Obviously, we're going to have to go to virtual training on many of those things to satisfy the social distancing and the governor's order as it exists at that time for large groups.
Okay. If a district is providing an online option to students, will the district have to seek an A5 designation?
No, absolutely not. We want you to, we want this to be seamless. We want you to, if Kevin and Connie decide to stay home because their parents don't believe that Kevin and Connie need to be in a congregate setting during a global pandemic, we want you to be able, and I know it's still not going to be easy, we want you to say to Kevin and Connie's parents, here's what we can offer you in a non-traditional environment. Ideally, if Kevin and Connie don't have Wi-Fi access or access to technology, I know many of you are trying to work to get that in the hands of your students. That could be a little easier if you just have a small percentage of your students that are choosing NTI, as opposed to obviously a very heavy lift if the entire district is on NTI, as we were at the close of last school year.
Okay. Next question. I think we're getting to the end here. Does the guidance of 5 and under not wearing a mask still remain intact?
Yes.
Okay. Okay. All right. And I think that is, unless I've missed, there's a couple of athletics questions in here that I am flagging for when Julian Tackett can join us. And I have been in conversation with him. I think we're going to try to get him, if not next week, we'll get him in here soon. But we will also work on getting these questions answered.
So I can close this out. I want to thank everyone for your patience, and I know there's anxiety there. I know the pressures you're getting in your community. I can't even imagine. You get that when you go to church, when you go out to eat, or go to the grocery store, see people in your neighborhoods. And I know that's tough and that's hard. I believe that tomorrow, when you see the guidance and the way it is formatted, I think it's going to be able to get us down to the next step along the path. So I want to thank you for that. And your patience for all of that, and your feedback, because it has resulted in a better document, both the KDE documents and the public health document tomorrow. So also, we had tentatively planned on maybe taking a break on the Education Continuation Task Force, the Superintendent's Advisory Council, and then next week's Superintendent Webcast because of the holiday. But right now, I believe we need to continue those. We understand attendance may be down because maybe you are taking some time and going somewhere. But due to the fact that the guidance is being released tomorrow, and we're moving closer and closer to the school year, we are going to continue to keep on schedule. Obviously, these webcasts are archived, and you can, if you happen to be on vacation or with your family, you can watch those at a later time. So as of right now, we're going to stay on with all of our advisories right on through the holiday week as we normally would, just recognizing the importance and the timeliness of this feedback. So everyone have a great rest of the day. Tony, do you have any closing comments?
Yeah, I just wanted to remind the superintendents that the transportation guidance document, normally that we release our KDE guidance documents on Mondays, but we have been waiting for the Healthy at School document to be released by DPH. So you will be receiving that guidance document on transportation on Thursday. So look, as soon as we're able to get that out to you, we will get that out to you as soon as we can.
All right, Dr. White, team, other KDE presenters, thank you so much.